haven't heard from the Clintons in quite some time, which is probably all for the best. I mean, the last time I saw Hillary Clinton mentioned in trending news, she was congratulating Donald Trump for, being warmongering and authoritative as she is when it came to Iran. That was the last thing I pretty much saw of Hillary Clinton, and then she kind of went dark, and the rest of the family kind of went dark. So it's probably for the best. Probably for the best that she's not making any more media appearances. But Chelsea, the darling Nepo baby daughter, has made a headline for herself because she's announcing she's launching a new podcast targeting public health misinformation. Because I can think of no one better than, doctors, nurses, medical practitioners, scientists, virologists. Even the cast of Grey's Anatomy, I put ahead of Chelsea Clinton. But she's going to launch a podcast targeting public health misinformation. Thank God at a time like this, she's going to launch about misinformation. It didn't come about when it came to COVID or the opioid crisis or anything prior to that. But now's the great time to come out of the shadows and propagandize people about misinformation. Good for her. So this is from The Hill, and it says, Chelsea Clinton, the daughter of former President Bill Clinton and former Secretary of State Hillary Clinton, is launching a podcast about public health. She says, how many of us have looked at the latest headlines and thought, that can't be true? Starting tomorrow, I hope you will join me and a series of experts on my new podcast. That can't be true. Together, we will sort fact from fiction, especially on issues impacting your health. Chelsea Clinton wrote in a Wednesday post on social media platform X. Clinton is not new to the podcasting world. She's hosted another podcast called In Fact with Chelsea Clinton, which stopped airing in April of 2022. She had another podcast that failed, that tanked. Her and her mother also had a documentary series on Apple. Remember Gutsy? They were supposed to go around the country and find, courageous women, very strong, assertive, gals and women of all sorts, all backgrounds, highlight them in this documentary series. Yeah, it's too bad they didn't reach out to people like Whitney Webb. They didn't reach out to, Kim Iverson. They didn't reach out to a lot of different they didn't reach out to Tulsi Gabbard, a combat veteran. But they'll reach out to Megan Thee Stallion and the actress that plays a detective on Law & Order. Not an actual detective that combats, child sex crimes. Because, with Bill, you can't really go too deep in that. But they'll get the actress from Law & Order. So she's going to go back to another podcast that probably no one's going to listen to. Things are getting weird in the world of public health. Childhood vaccines are suddenly up for debate. Fluoride is being described as industrial waste, and it feels like everyone is talking about raw milk. Yeah, those aren't new conversations. Those aren't new. People have been having this discussion for decades. Decades. You look back prior to COVID, people like De Niro had a film out at the Tribeca Film Festival. He was promoting on the Today Show about vaccinations in children. You look at Jenny McCarthy when she was interviewed by Larry King, and everyone made fun of her for questioning the vaccines. Even RFK Jr. was on Chuck Scarborough on MSNBC in the late 90s talking about this. Like, this is not new conversations. People have been having discussions about this for decades. The reason why it sounds new to her is because for the first time ever, we're actually exposing this to mainstream attention. And that's in part because of RFK Jr. and the Maha movement. They're finally bringing attention to these conversations that we weren't allowed to discuss openly. We're not allowed to have these discussions, but people talked about it. People were concerned about it. They were wondering, curious, and observing all these different scenarios, but we weren't allowed to openly discuss it. But now, thanks to RFK Jr. and the Maha movement, people have become more vocal about this. People become more vocal about these issues that people have been having for decades. She says, navigate this chaotic time with public health expert Dr. Chelsea Clinton. She has a doctorate who every week talks to doctors, dietitians, parenting experts, and more to expose pseudoscience and help us sort fact from fiction. Clinton teaches health policy at Columbia University. No way. And also serves as the vice chair of the Clinton Foundation. Well, I would expect that. But she has a doctorate to teach health policy at Columbia. Wow. Well, when you get a fancy name like that, anything's possible, right? I mean, Kim Kardashian, who they interviewed on the Gutsy show. Kim Kardashian apparently has like a law degree, but can answer simple legal questions. Very curious about that. The launch of Clinton's podcast also comes amid heated debates over health policy in the U.S., especially surrounding Health and Human Services Secretary Robert F. Kennedy Jr. and his policy stances. Again, she didn't launch this when it came to the lies about COVID. She wasn't trying to discredit Anthony Fauci or Bill Gates or any of those figures. They're not going after them, but immediately because of RFK Jr., they won't tackle any of the other lies that have been proven over many, many years of big pharmaceuticals colluding with the government, colluding with agencies, how the FDA and the CDC are massively corrupted. She's not going to mention about that, but she's going to launch a podcast specifically because RFK Jr. is at the helm of Health and Human Services. Very interesting. More than 1,000 people who have been employed by HHS recently demanded Kennedy resign after his ouster of the director of the Centers for Disease Control and Prevention and other moves they claimed were compromising the health of the nation. I think that ship has kind of sailed. Compromising the health of the nation. I think when you add dyes to breakfast cereal and give that to children, when the water is so contaminated, when you have health agencies being corroded by corruption of big sugar and big pharmaceuticals and when you have Rockefellers who manufacture pharmaceutical drugs from petroleum, I think the health of the nation has already been deteriorating. So bringing a podcast this in 2025 and mentioning about this, it's a little too late. It's a little too late. But the reason RFK Jr. is bringing this to attention is because these are conversations that people have had for decades. Decades. And Chelsea Clinton says, no, I got to combat this misinformation. I'm sure like Elizabeth Warren would be proud of her. So apparently, she has a doctorate and she teaches health advice at Columbia University. I had no idea about that. That's amazing. And, well, let's see what kind of health advice she gives. So, according to Chief Nerd, it says Chelsea Clinton announces the Big Ketchup Initiative, which will be the largest childhood immunization effort ever. We need the public sector to hopefully stop doing things like stripping away public health emergency powers from state public health agencies. We're working with the WHO and the Gates Foundation and others to hopefully have the largest childhood immunization effort ever over the next 18 months to catch up as many kids as possible. So even in that statement, it's contradictive because she's saying that while we can't allow for restrictions of public health measures. She's teaming up with two global agencies that are by design responsible for overreaching and stripping away state and local authorities. That countries lose their sovereignty. That was the part of the pandemic treaty. That countries lose their sovereignty and they get ousted by these agencies that are massively corrupted. I mean, the Gates Foundation, I don't even need to explain. But the WHO, we know that the Gates Foundation is one of the biggest donors. We know that big pharmaceuticals play a huge role into this. And when there is a pandemic, they give legal authority to override the abilities of other countries, local and state governments, to pursue their authoritative agendas. So that statement right there is contradictory of itself. And here's Chelsea Clinton at this event here by Fortune magazine, going to fearmonger people to get your kids jabbed up because she's backed by the WHO and the Gates Foundation to preach you about health.
I do think, though, when you ask about the role of public-private partnerships kind of after the last few years, I think we spend so much time, understandably, focused on the mRNA vaccines and technologies. I spend a lot of time thinking about the really unfortunate, to try to use a not too judgmental word, kind of rise in not only kind of vaccine hesitancy and questioning, but outright kind of rejection of vaccines and of kind of science and the scientific kind of process. And
you mean curiosity? You mean questions? You mean like, hey, I'm a patient, I'm allowed to get a second or third opinion on something that's going to go into my body? You mean that kind of hesitation? You mean that people are allowed to have? When you go to a car dealership and buy a car, do you just take the one that the salesman tells you to take? Or do you go shop around? Do you ask questions? Do you ask about the fuel economy? What's the costing? What's the financing? How good is what mileage does it get? Do you ask certain questions? According to her, we can't have that. That's why she's doing a podcast to lecture you about the misinformation out there. She's going to lecture you and demonize you for having these thoughts. And as she's mentioning mRNA technology, does she feel any sympathy or remorse that the guy that invented the technology, Dr. Robert Malone, was canceled out by society for inventing the technology that brought us the COVID vaccinations? Do you feel any sympathy, empathy, remorse that the world tried to silence out a leading doctor who invented the technology that brought you these pharmaceuticals? Are you going to bring him on as an expert? I doubt it. See the rest.
Also, too often on our scientists, our epidemiologists, our frontline healthcare workers. And so I do think we need to have a much more robust conversation and sense of urgency because I think we are less prepared today than we were arguably in January of 2020, partly because of the kind of lack of trust and confidence in not only our scientists, but in science itself, and certainly in the public health professionals. And so I think we need kind of the public sector to hopefully stop doing things like stripping away public health emergency powers from state public health agencies. But we also need the private sector to help candidly do a better job of helping explain kind of the science that you are already commercializing.
So we shouldn't be questioning science. We shouldn't be looking to advisors to explain their theories or, follow up on data analysis. We just need more synergy. The synergy of public and private ownerships to take over and mandate more people. Just like we did during COVID. We just need big pharmaceuticals to corrupt more governments and tell them and lecture their people that you got to follow this path. Don't question the science. Don't question authority. Do as you're told and get into line. And anyone that questions it, anyone that has a curious thought or wants a follow-up, you're awful. You're disgusting. Noam Chomsky would tell you you got to go to a concentration camp. How dare you have these nasty thoughts? As Trudeau would say, it's part of the fringe minority. These people that are questioning things. Why do you want questions? Why do you want accountability? Just trust the science. And by the way, I just want to highlight this, because I didn't catch this until playing this video. You notice that the corner is showing a bunch of logos. These are the advertisers that are hosting this event. And one of them is Sage Therapeutics, and the other one is General Electric. General Electric is a military contractor. Why would they be concerned with Chelsea Clinton launching a health podcast? What is their initiative when it comes to health? A military contractor. They used to be the former owners of NBC. Why would they care about health? Why would they care about vaccinations?
Bringing to market, but also what you're working on, and help us kind of in the broader conversation not be uncomfortable with the discomfort of uncertainty. And so I do think we need really good ideas for how best to do that, because we all deserve to hopefully not be as unprepared as I worry we are at the moment. And the last thing I'll say is a new effort that we're a part of is the new initiative launched by the World Health Organization last week to try to catch kids up on their routine immunizations. In 2021 alone, more than 25 million kids under the age of 1 missed at least one routine immunization. And so we're working with WHO and the Gates Foundation and others to hopefully have the largest kind of childhood immunization effort ever over the next 18 months to catch as many kids up as possible, because no one should die of polio or measles or pneumonia, including in this country where we also need people to be vaccinating their kids.
Absolutely.
There you go. Being propped up by the WHO and the Gates Foundation to lecture you about how we need to do this initiative to get your kids more jabbed up with pharmaceuticals. Again, not consulting doctors, not consulting pharmacists, not consulting nurses, not consulting medical advisors. There's no data analysis. She's not providing evidence to back these. No. I just got told by the WHO and the Gates Foundation that we have to do this. And that there's many kids out there that aren't getting jabbed properly. And of course, she mentions about polio and measles, which, again, if you look at the actual scientific analysis, are vastly different than a lot of other vaccinations. You don't get the polio shot and then immediately get polio. You know, the measles, for example, and we showed this before, the measles, they used to show sitcoms back in the 70s joking about kids catching measles like it was nothing. You got a day off from school. Ooh, that's great. Nowadays, it's like another pandemic. Oh my God, someone caught measles at Disney World. We got to shut everything down. What happened? What happened? Where's the science that proves that now it's a national emergency compared to back in the 70s and 80s and whatnot that they used to joke about kids getting measles? That it was no big deal. What changed? What's the difference? No one's providing any facts or evidence to back these arguments. But all she's saying is, well, we're working with these organizations and they're telling us that we got to do this. Miss Dr. Chelsea Clinton. And a lot of people have commented on this video. I want to highlight this one in particular, because this is an actual MD, PhD, and says, and who gave Chelsea Clinton any authority whatsoever? She happened to be born to a person who became president. She achieved nothing meaningful in her lifetime and is capitalizing on her last name to sell books and make more money, not listening to her. Yeah, she's taking the Nepo train the same way that Meghan McCain was able to be on The View, or Ben Mulrooney is able to have an entertainment career in Canada, or Justin Trudeau becoming prime minister, or any of these other people, the Kardashians, to become famous. That's the only reason The only reason she's allowed to do this is because she's the daughter of a famous political elite family. She has no real background in medicine. She hasn't worked in laboratories. Have you seen her in a lab coat? Have you seen her working at the hospital with children? But she's going to launch a podcast to try to crack down on misinformation in the medical world, and it's going to bring on experts. Well, considering what we've seen with Gutsy and other interviews that the Clintons have done, the people that they brought on, I don't think those experts are to be trustworthy. You have a show called Gutsy to highlight, very, strong women, and you pick Megan Thee Stallion as one of them. That kind of shows you the direction of how their expertise really is when it comes to the subject. So, Delete Your Handler stated this. It says, when the daughter of regime royalty launches a podcast about misinformation, you're not hearing journalism. You're watching the containment field activate. This isn't truth. It's a firewall to protect the throne. They inject the lie through lineage. They present it like correction. A Rockefeller lectures you on raw milk. A Clinton lectures you on childhood immunity. That's not a podcast. That's a spell with a studio budget. This is an education. It's pharmaceutical theology in a lab coat voice. They don't debunk the truth. They dispose of it ritually. The goal was never clarity. It was the anesthese resistance with curated dissent. They whisper compliance. They call it health. You were supposed to clap while they erased you. So that's the definition. That's what this podcast is. It's not there for journalism. It's not there to correct the record. It's not there to provide evidence or factual-based claims. It's there to lecture you and brainwash and propagandize you, stern you into accepting the pharmaceutical narrative. Backed by the WHO, the Clinton Foundation, the Gates Foundation, and other pharmaceutical lobbies that the Clinton family has invested in over extended periods of time. And that's why Chelsea Clinton's allowed to have a podcast like this, while Dr. Rob Malone and Dr. Peter McCullough and others were silenced out of the medical community during COVID. But I doubt they're going to be mentioned in this podcast as experts. Award-winning physicians and cardiologists. The guy who manufactured the technology that brought you the vaccines. And speaking of which, I want to highlight this because she mentioned about childhood immunization. Did you know, and I didn't know about this until I did some digging around during COVID, one of the very first shots you get for a newborn infant is hepatitis B. I had no idea about this. A lot of people don't know about this. One of the very first shots in the United States and around the world, actually, is for hepatitis B. And the thing that doesn't make sense to me, the thing that I found illogical with that statement is you look at the bottom here where it's highlighted. It says hepatitis B is spread in blood and bodily fluids. Ways it could be spread include having sex without a condom and sharing needles. Why would you give that to a newborn baby? Since when was a mother's uterus worse than a ghetto in Toronto? Why would you give that to a newborn baby that was just born? Are you worried that infant is going to have unprotected sex and going around sharing drug needles? Like, why would you give that to a newborn baby? And it even says underneath it, it says there's a vaccine that can help prevent hepatitis B. The vaccine is offered on the NHS, that's the UK healthcare system, to all babies. All born in the UK and some people at high risk. Now, the argument that people make about it and why they do it for newborn infants is because they don't know if the mother is contaminated with hepatitis. And that's why they want to do a measure to protect the newborn infant, because if the mother is contracted with hepatitis B, then that can transfer through the umbilical cord, through blood and whatnot, to the newborn infant. And what myself and many other people, including scientists and doctors, have examined and asked curious questions about is why they're not doing studies and testing on the mother then. If they're concerned that the mother might be contaminated with hepatitis B, why aren't they doing studies on the mother to prove that? Why aren't they doing a check on the mother to see if she has hepatitis B? And then if she is contaminated with it, then proceed with caution to make sure the child is safe. But don't give it to all babies if they're not contaminated with hepatitis B. Why would you do that? Why would you do that to all newborn infants under an umbrella term? It doesn't make sense. It doesn't make sense if you're a pharmaceutical representative that wants to cash in on the opportunity. And I just also want to bring this to attention, which I doubt Chelsea Clinton's going to mention on the podcast, is this video here. It's 19 minutes long. We're going to show a bit of it here, sped up. These are a series of news clips of people with adverse side effects came after the COVID injections, which they were trying to cover up extensively, and they're still trying to cover up. They're trying to say that it doesn't exist, that people having adverse side effects, oh, that's not real. But here's a series of news clips of people, literal news clips of people who got the injection and are dealing with adverse side effects that are affecting their health, that's affecting their ability to live a normal life, and they're doing worse off now than they were prior to COVID. I have to put the disclaimer out there that all this is what they're saying. I could tell you that's very safe and effective according to CDC and FDA guidelines, according to YouTube standards. So, do as you will. Do as you will. Do your research. Consult a physician. But let's see what this little montage is about.
24 hours after receiving her second dose of the Pfizer COVID-19 vaccine, she was unable to move from the neck down.
Last month, a Tennessee woman who was left partially paralyzed after getting her second dose of the Pfizer vaccine.
Only 11 spoke with a local woman who says she lost feeling in much of her body just hours after getting Pfizer's COVID-19 vaccine.
You are, as you write, one of the unlucky ones who was diagnosed with Guillain-Barré syndrome.
A BC man who says he suffered a rare COVID vaccine injury that left him paralyzed will be getting financial support from the federal government.
Now, if you got sick after taking the vaccine, what would happen if you did get sick after taking the vaccine and when you tried to get help, everyone just treated you like you were an anti-vaxxer?
The vaccine took my immune system and just shook it around again. Agony and chronic pain.
In our coronavirus coverage, a Utah woman and Utah senator are teaming up to get some answers. This comes after a group claims they've experienced life-altering injuries that they believe are from the vaccine.
A shocking reaction to the COVID vaccine. New at 5, the CDC says coronavirus vaccines have been remarkably safe and successful, and serious adverse reactions are rare.
Yeah, more people have died under COVID this year, by the way, under Joe Biden, than under you, and more people took the vaccine this year. So people are questioning how.
Well, no, the vaccine worked, but some people aren't taking it. The ones that get very sick and go to the hospital are the ones that don't take the vaccine. But it's still their choice. And if you take the vaccine, you're protected. Look, the results of the vaccine are very good. And if you do get it, it's a very minor form. People aren't dying when they take the vaccine.
We used to go fishing, camping, do everything. We got the Pfizer vaccine because I thought it was to protect him. I thought it was the right thing to do. It was like playing Russian roulette. My government lied to me. They said it was safe. Now I go home to an empty house.
This is a simple, basic proposition. If you're vaccinated, you're not going to be hospitalized, you're not going to be in an ICU unit, and you're not going to die.
Multiple agencies are now investigating what caused his death.
CBS 13's Marissa Perlman is in Auburn with the woman who says she witnessed that man getting this shot. Marissa?
Yeah, a lot to learn about this one, Steve. First, the county posting on social media that a person was diagnosed with COVID-19 back in December and then died just hours after getting the vaccine on Thursday. This news now causing concern in this community, now questioning the safety of the COVID-19 vaccine.
And the J&J, if you look at them, particularly in things that we really care about that are important, it's got greater than 85% efficacy after severe disease and critical disease. And there were no deaths or hospitalizations in any of the countries that were tested. And remember, they tested in the United States, in South Africa, and in South America. This is a good vaccine. I think we need to pull away from this comparing and parsing numbers until you compare them head to head. Just be really grateful that we have 3 really efficacious vaccines.
So that's just a little highlight on the post-aftermath when it came to the COVID vaccine injections. Do you think Chelsea Clinton, in her new podcast discussing medical misinformation, talking to experts and revealing the truth, telling people, informing people, is she going to bring attention to this? Is she going to bring attention to this? Or is she going to be one of the demonizers that go after people and say, you're making this up? Oh, you're paralyzed from the neck down? No, that's a lie. It's you're mentally messed up. Because that's what they do to people. They demonize them. They demonize people that have adverse side effects. Even though they were lied to, fear-mongered, propagandized to get this experimental vaccine, this experimental injection. They were told that is effective. They were told that it was safe. They were told that nothing was going to happen. That's extremely rare for these side effects. And now you're seeing all these side effects are coming out across the nation and around the world. People are experiencing this. So is Chelsea Clinton going to mention this? No. Not when you're brought to you by the pharmaceutical agenda. Not when you're brought to you by the WHO, the Gates Foundation. When you work at Columbia University and rely on those so-called experts that are also in bed with the pharmaceutical agenda. So, of course, she's not going to mention about that. It's just, again, just like that tweet mentioned, it's window dressing to make it look like an informative podcast, but it's propaganda. It's lecturing you to fearmonger and bait people and manipulate people into the pharmaceutical lobby. And here to remind people, this is from CNBC. This is from 2016. Despite her rhetoric, Big Pharma likes Hillary. This is from March 10th of 2016. This is when she was campaigning. And she was making grand statements about how she was going to go after the pharmaceuticals and she was going to do a better job than Bernie was ever going to do. Bernie's also a liar on this. I'm not giving him credit on that. But she's even worse. She's even worse. And you can see underneath it, the first line, the pharmaceutical industry has donated over $500,000 to Hillary Clinton's campaign. That's just the campaign. That's not including the Clinton Foundation. That has millions of dollars more that Big Pharmaceuticals donated to the Clinton Foundation. So, Chelsea Clinton launching a podcast about health and safety and correcting the record on misinformation. It's not about information. It's not about science. It's not about informing people. It's propaganda. And the reason she's choosing now to release this critical podcast is because people like RFK Jr. and the Maha movement are challenging the official narratives we've been lied to by the pharmaceutical agencies, by Fauci, by Joe Biden, by Kamala Harris, by Trump even himself. You saw that lie there he gave to Candace Owens. They're challenging the official narrative because people are dealing with adverse side effects they couldn't even imagine because they weren't told properly about it, and they can't even do anything about it because the big pharmaceuticals gave themselves ultimate immunity, legal immunity. You can't sue them. You can't counteract. You can't bring a lawsuit to the pharmaceutical lobby. Why would that be the case? If it's so safe and effective and nothing could happen, it's very rare that people will get adverse side effects. Why would you need to have that ultimate legal shield to protect you from any wrongdoing? Why would you need that? Why would you need to cover up adverse side effects for 75 years? Why would you need to do that? Because they're liars. They're malicious liars. And Chelsea Clinton is promoting that malicious lie. She's not providing you evidence or data or analysis to back any of her arguments other than the fact that she works in coordination with the WHO and the Gates Foundation that is in partnership with the big pharmaceutical mafia to give you malicious lies that people are still dealing with to this day. And that's why I still bring attention to this. I know people will say, why are you still talking about COVID? Move on from it. That was like 5 years ago. Tell that to the people that are paralyzed. Tell that to the people that died. Tell that to the people that are severely injured that have to cope with this for the rest of their life. Oh, we got to move on from COVID. After the malicious lies have been told to a global scale. After people have suffered and lied to and betrayed and manipulated. Oh, you just want to move on from it. That's why I keep bringing attention to this. And Chelsea Clinton launching a podcast to go after medical misinformation. This is all just more propaganda to further demonize people because no one wants to reveal the truth of big pharmaceuticals. How awful, malicious, and disastrously they are for human health. According to YouTube standards, it's very safe and effective.